I'd now like to introduce me to talk about our community survey results. And I'm really pleased to be able to talk to you about these today because so many of you were so involved in helping us to promote these surveys and distribute the surveys and get the message out there so that we actually had a really good response to our community survey. So thank you, everybody. Before I start, and I'm not really very clever with all this, Susan, I might need to take. Yes, okay. I wanted to share with you a little bit about why we undertook the survey and what we hoped to achieve. And as Susan pointed out, we do have our national standards. Late last year we developed the community engagement strategy, and the strategy was developed with the national standards in mind, specifically National Standard 2, partnering with consumers. And while meeting the national standard and National Standard 2 and how it impacts on our organisation is very important, and it drives the work that we're doing, but more importantly than that, as an organisation and under Susan's leadership, I'm sure you'll agree that MLHD really genuinely does want to engage with consumers and consult and inform, and that relationship that we have with our consumers is really important, and that more so than the national standards actually drives the work that we do. Now, one of the key objectives of the community engagement strategy was to keep our communities informed about the health services that we have available and of decisions coming from community engagement. And in order to do that, we actually needed to establish a baseline or a starting point so that we could actually assess the effectiveness of our communication strategies, and so that we could identify gaps and understand how people need to be informed. Whoop, wrong way. Okay. And so with those aims in mind, the community engagement strategy was developed, and we actually developed that using our own statisticians and researchers to guide the sorts of questions that we'd be asking, to make sure that we would have some valid responses and some really good data that we could work with. So the survey was launched in January, as you know, and with the support of our LHACs in distributing and promoting that survey, we actually had a really good response. The survey closed in mid-March, and it was available online, and also hard copies were distributed. So the findings. Demographic profile. I thought I was being really clever with my slides here. We had 1,200 respondents in total, and those respondents were predominantly female. About 75% of the respondents were female, and the largest segment that we received feedback from was between the ages of 50 to 68 years, with 43% of respondents falling within that age group, and predominantly with a nuclear family. Compared with national statistics, obviously our respondents were more heavily weighted towards the older age group. And you can see here the breakdown of the ages that we received. So we did get representation from across the board. So just looking at the questions, the first question on the survey was, have you or a family member been admitted to a local public hospital in the last 12 months? And you can see there it's pretty much a 50-50 split. We asked this question in order to evaluate whether or not an experience with their local hospital would have any impact on their level of knowledge about the services provided or their perception about the services provided. And what we found was that there's actually no significant difference in the responses between people that have had an experience with the hospital and those that haven't. So the impact of a previous experience pretty much was negligible on these results. Of the respondents, so of those 50% who had a previous experience with the health service, we asked them to rate their experience with the hospital. And what was really pleasing here was the results that Susan shared with us earlier from the New South Wales survey. Our results are actually very consistent. So we knew there we had valid data that we could work with. And you can see here from the results that overall the respondents rated the professionalism of our nurses and doctors as positive, while waiting time and discharge procedures are identified as areas that require some further investigation for improvement. There were some specific sites identified, Albury, Berrigan, Griffith, Wagga and Young, as indicating that they required some areas of improvement in staff communication, and that was, I think, reflected in some of the results that we had from across the New South Wales as well. And we're actually doing some more analysis. We will have a breakdown of these statistics by location. So after the forum, I'll be sending that out to each of the LHACs so that you can actually have a look at your own statistics for your own site and see what those results are telling you. Okay, the next question that we asked was from their own experience or knowledge, what services were available locally. Now, around 20% of respondents didn't know if services were or were not offered in their local community. And again, a breakdown of the statistics by location will provide a greater insight into what's happening where across the district. And overall respondents, with the qualitative feedback, we had spaces for people to comment. So that qualitative feedback indicated that community members didn't believe they had access to mental health services, when in fact we know that mental health services are offered at each of our sites across the district. So that's obviously an area that we need to improve our communication. And I've just had in an email last night from our statistician analysis, who's run a regression model to examine the factors associated with correctly identifying what health services are available. And I have more information to come. He's going to provide me with the details, but he said the general information that was coming through was there seemed to be the factors affecting whether or not people knew about the services was their gender, their family type, whether or not they read the newspaper positively impacted on their understanding of what services were available. GP referral, again, was a really clear area. Information days and hospital visits were also key areas that actually helped improve their level of understanding of the services available. So when those findings are available, I'll actually pass those on as well. Okay, the next question we asked was, where have you seen information about services provided? And many of the respondents here indicated that they find out about the health service either by visiting the service or by referral from their doctor. I know that's very small, but I do have the data that I can hand out for you. Now, 16% of respondents didn't actually recall seeing anything about health services facilities, and the qualitative responses indicated that quite a few people found out about health services through family, friends, colleagues who are employed in the health service. So the next question we asked was, how would they rate the accessibility of information about information services, the quality of information about services, and the readability of information about services? And what we found here was that nearly 34% of respondents thought that the accessibility of information about services was inadequate. And many of the qualitative responses indicated that information is often quite difficult to find. So some of the comments that we got back were along the lines of, it takes a lot of investigation to find out what resources are available and how to access them, that it's not advertised well enough and people don't know about the services in their local community. So when they were asked where they would go to find information about local services, respondents indicated that most would go to their GP, nearly 68% would go to their GP, and 65% indicated they'd call or visit the hospital as their main source of information. And that data is consistent with the graph we saw a little earlier with where they actually found their information previously. Interestingly, about 30% of respondents indicated that they'd visit the website for information, whereas you would have noticed on the previous slide, only 2% of respondents indicated that they actually sourced their information from the website. So that might indicate that's an area for us to strengthen in providing information to our consumers. Word of mouth remains a really high source of information, with 40% of respondents indicating that they would seek information from a friend, colleague or family member. And other qualitative responses indicated areas like community information directories, local councils, online, social media, billboards and so forth. Now, since accessing information has been identified as an area for improvement, locating information about services in locations that community members are likely to look is actually probably one of the ways that we can address the shortfall. Okay, this question. Do you recall seeing anything about MLHD in your local paper recently? You can see here about 50% of respondents indicated that they couldn't recall seeing anything about MLHD in their local newspaper, and 11% indicated that they don't actually read their local newspaper at all. And those figures were particularly high for Tumut and Wagga Wagga. Which is good for us. 38% could recall seeing something about MLHD in their local newspaper recently. And I suppose by way of background, our Public Affairs Department has actually distributed district-wide media releases in the lead-up to and throughout the duration of this survey, with really good take-up in local papers. So there have been articles. It's just that people don't recall seeing them. Have you heard of your local health advisory committee? Do you think your LHAC represent the needs of your community, informs your community about health services, and advises the local health district on what services are needed? So the three functions of the LHAC. So of these respondents, so what happened was the respondents that said yes, they had heard of the LHAC, were then asked these questions. So of the 50% that we saw on the previous slide that had heard of the LHAC, 62% believe that the LHAC represents the needs of their community. 45% believe that the LHAC informs the community about local health services available. And 52% believe the LHAC advises the health district on services that are needed. Around 56% of total respondents either didn't know about the LHAC or didn't believe that the LHAC represented the needs of their local community. And of those who had heard of the LHAC, around a third did not know what the LHAC did. And there was, we know that there was, quite a good response from LHAC members and staff. So, okay. These are some of the qualitative responses in the feedback about the LHAC. And this was, I don't know, do you want me to read those out? Okay. So what are our key learnings? Our organisational brand in the marketplace. It's quite clear from the results that there's been confusion over what Murrumbidgee Local Health District's role in the marketplace is. And there's, from some of the qualitative responses, we can see that there's a confusion over our function and Medicare Local. There's a little bit of confusion over what we do and what Medicare Local do. The LHAC profile, role and responsibilities. Local people don't know about the LHAC and we need to raise the profile locally. Accessibility of information about services. Current information about services is difficult to access. Primary go-to places are the GPs and health service, and so information really should be located there as a bare minimum, and we also need to have a look at the availability of current information on our website. And as I said at the outset, the impact of previous experience with the health service is negligible and didn't impact on whether or not people knew about services. So what's next? We had around, of those 1,200 respondents, we had around 360 odd respondents indicated that they would like to be involved in further research or surveys, which is really good for us because we want to run focus groups and find out more about, what exactly we can do at a local level to improve our communication. And so what we're planning to do is run focus groups during May and June to further integrate some of those opportunities and pull some of those ideas out, and then we can start to tailor some communication plans for local communities.